Everybody. Hi, I'm Dr. Steve Braverman. I'm the director of the VA Greater Los Angeles Healthcare System here. I appreciate you all coming here to hear a little bit about our vaccination effort and what's happening across the state. Here at the VA Greater Los Angeles Healthcare System, we've given approximately 83,000 vaccination shots since we started back in December of 2020. We were fortunate to be a Pfizer site, which means that we were able to get vaccine delivered to us as soon as vaccine became approved and available for the emergency authorized use. Among those 83,000 shots includes 75% of the 90,000 veterans who are enrolled here, as well as the vast majority, almost the entire 5,500 employees that we have here at the VA Greater Los Angeles Healthcare System. Since the boosters became available, we've given an additional 10,000 vaccines, which include about 1,500 to our staff here. So that has had an impact on the number of people who have been admitted during this last surge in the pandemic. We've had a very low level of inpatient admissions as compared to what we had last winter, along with the trends that we see across the entire state of California. And the vast majority of those admissions were unvaccinated veterans. The few vaccinated veterans who were admitted either had very frail prior medical conditions, or they were admitted because they were admitted with COVID, not because of COVID. So they were admitted for some other condition. So this has been a very good effort. And in fact, when we started, we also partnered with our CalVet partners to help vaccinate the folks in our West LA Veterans Home to great effect there at the beginning of the pandemic. So with that, I want to introduce the next speaker, who is Dr. Vito Imbasciani. He's the Secretary of the California Department of Veterans Affairs and also a retired Army physician, as was I. So Dr. Imbasciani, thank you.
Good morning, everyone. I'm Dr. Vito Imbasciani. I'm the Secretary of the California Department of Veterans Affairs, and it's my mission to serve the 1.6 million veterans of California. And happy Veterans Day tomorrow to all the veterans that are listening to this. I am so honored to be here today with my boss, the governor. Last year, we were together at the Veterans Home in Yountville in Napa County, where he came out then to show support for how well we were doing, how well the staff and the veterans who were living there did during the pandemic. And I'm happy to report to you that we continue to keep COVID at bay throughout the 8 veterans nursing homes in California. Much of that success is due to the men and women who live and work throughout the homes in their strong commitment to each other and to the fact that to an extraordinary degree they are vaccinated. Across all 8 of the state's veterans homes, the vaccination rate among our residents, veterans and their spouses is over 94%. Vaccines and boosters are now very, very easy to get and absolutely vital as we head into winter. Our success over these past 20 months is also due to our strong federal partners here at the VA medical centers throughout California, but including especially this West LA Veteran Hospital Medical Center team. These are trying times, and we have reasons, however, to be hopeful. Just at this campus alone, the future looks very bright. With the support of the governor and the legislature, the Veterans Housing and Homelessness Prevention Program, VHHP, which is administered by CalVet and the Housing and Community Development Department, has awarded 29 veteran-specific housing projects in the LA area alone. This totals over $127 million of housing funds, creating a total of 901 veteran-specific housing units. The goal of the VHHP program is to build more housing units, which include supportive services that are vital for low-income and extremely low-income veterans. And that's not all. For the next round of awards, the 6th, VHHP will grant an additional $73.2 million to 8 projects in the LA area. And of those 8 projects, 3 of them, totaling $39.6 million, will come to this campus alone. California is making historic investments in housing and behavioral health, which helps ensure that our most vulnerable veterans are getting their basic needs met through housing with wraparound services. None of this would be possible without important community partners such as U.S. Vets, Century Housing, and the other partners who make up the West LA Veterans Collaborative for this campus. More than 1.6 million veterans call California home. Los Angeles County is home to more than 279,000 of them. And as we usher in our official day of celebration tomorrow, Veterans Day, I want to acknowledge all of my fellow veterans and to let them know that CalVet will be with them every step of the way as they transition and journey from their military service and as they build a bright future in the years and decades to come. But again, remember the bottom line, get vaccinated, and if you're vaccinated, get the booster and the flu shot. Happy Veterans Day to all. Thank you. I'm going to introduce you my fellow colleague on the governor's cabinet, Dr. Mart Galley, an esteemed pediatrician who now is the Secretary of the California Department of Health and Human Services.
Thanks, Vito, and thank you for welcoming me to the VA. It's tremendous to be at another site doing the important work of making sure Californians are getting vaccinated here in Los Angeles. VAs, hospitals, health systems across this state, pharmacies, federally qualified health centers, and a number of primary care clinics are doing the work as we speak of getting Californians vaccinated against, yes, both COVID and flu. It's a tremendous privilege to be here this week again as we ushered in the beginning of getting our youngest Californians, some of our youngest Californians, 5 to 11-year-olds vaccinated. Over 110,000 young people, 5 to 11 in California, as of this morning, have received their first shot. That is tremendous effort. That is just the beginning with over nearly 1.6 million shots here in California available to young people. We are starting to see this pick up, and I'm really encouraged about what this means for our state. 9% of our population able to get vaccinated now, where in a week ago they couldn't. But I really want to spend a moment on the message of boosters and making sure that we're driving home how important it is for those who've had their primary series, Moderna, Pfizer, more than 6 months ago they completed it, Johnson & Johnson more than 2 months ago, that if you think you will benefit from getting a booster shot, I encourage you to go out and get it. Supplies available. There are many sites across the state, thousands of sites, in fact, available today to help provide you your booster. It's not too late to get it this week. Get that added protection for the Thanksgiving gatherings that you may attend. Certainly going into the other winter holidays, it is important. What we are seeing is that more cases among those who were vaccinated early. We're concerned about what it means for hospitalizations and pressure on our healthcare delivery system, but ultimately for your safety and protection. So now is the best time to consider getting that shot, and while you're there, ask and inquire about getting your flu shot if you haven't already. Just some sobering facts. Not only are you 5 times more likely to be infected by COVID if you are unvaccinated, but 20 times more likely to die. And so with that statistic in mind, I really just want to continue to deliver home this strong point that vaccines are our way through this pandemic. We are concerned about the winter. We're concerned about rising case numbers, pressure on our hospitals from a number of other issues on top of COVID. So do what you can today to get your vaccine. Protect yourself into the winter. And just one other moment, to see the tremendous work here on the issue of homelessness and housing some of our most committed Americans, Angelenos here in this county, making sure that we continue to drive home the message that health and homelessness go together, that we have to address the healthcare needs of those who are experiencing homelessness, not just when it comes to COVID, not just when it comes to physical ailments, but also those behavioral health issues. So, Governor, just really appreciate the way you lean into the issues around health and homelessness, the connection around behavioral health, and excited to continue building the programs available to the members and residents of this facility, but also across this county and across the state. And with that, I'll have the privilege, second time, Senator Padilla, this week we were together earlier in the week at a school vaccine site kicking off the 5 to 11 at Arleta High School in the Valley. So really a pleasure to welcome you here home, welcome you as a stubborn advocate for equity and working hard at the federal level to make sure we have what we need to address the pandemic and other issues here in California. Thank you.
Thank you, Secretary Ghali. Good morning, everybody, and thank you for joining us. Proud to be here with the governor at the West Los Angeles VA Medical Center to meet a few veterans along the way who were getting their boosters in some cases, their first shot in some cases, their flu shot in some cases as well, and not just to thank the important staff here, the doctors, the nurses, all essential personnel for the work that they do, but to learn more about how else we can and should be supporting veterans. Also here to celebrate California's tremendous progress, thanks in large part to the leadership, the leaning in, as Secretary Ghali mentioned, of Governor Newsom. California has led the way in getting vaccines out to every corner of the state. California has administered more than 55 million doses of the COVID-19 vaccine, far and away more shots than any state in the country. And thanks to the American Rescue Plan for making the funding and those vaccines available. Look, we all know vaccines are key to ending this pandemic. As Dr. Ghali mentioned, we were together just a few days ago celebrating the beginning of 5 to 11-year-olds being able to get their vaccine, and highlighting just one of many examples, the Los Angeles Unified School District bringing mobile clinics to school campuses, making it easy as possible for families to get their children vaccinated. I'll also take a moment to speak as a parent. You know, my wife, Angela, and I couldn't be more excited about our two younger boys finally being eligible for their vaccines. In fact, they're so excited. For the first time, they're excited to go get a shot. That tells you something. I think in return, they're going to buy us ice cream, not the other way around. But my real serious point is this. It's not just the public health experts. It's not just the medical professionals. Our children know how important these vaccines are for their health and safety, for that of their friends and classmates, for that of their families and our communities. And it's a significant step back towards normal, especially with the holidays upon us and family gatherings over the next couple of months. So it is a celebration here at the West LA VA Medical Center. Again, a big thank you to all the personnel here, but especially to veterans. As we are on the eve of Veterans Day, we take a moment to acknowledge and to thank veterans who have served our country over the course of generations and offer more than just our gratitude. And we shouldn't just think of them tomorrow, we should think of them each and every day. As a senator, I'd be remiss if I didn't articulate my commitment to providing veterans all the benefits and all the respect that they deserve and that they have earned. And think about that. When we think about veterans, we talk about honoring people who have served to protect others. And that's exactly what each and every one of us can do when we sign up for the vaccine. We can get vaccinated to help protect others. What a way to honor the spirit of Veterans Day. So please, if you're one of the few out there that haven't been vaccinated yet, what are you waiting for? Sign up, make your appointment. Vaccines are free, they're safe, they're effective. And if you're a parent or a guardian, it's time to sign up your kids. Vaccines are available. Go to myturn.ca.gov, just like the governor told me to. And together we'll get through this pandemic. And before I introduce the governor, if I may just offer a few words in Spanish as well for our Spanish language press. I see some smiles and heads nodding yes. Muy buenos días y muchísimas gracias por acompañarnos hoy en este Centro Médico de Veteranos. Sabemos que mañana es el día oficial cuando reconocemos los sacrificios y el servicio de tantos miembros de la comunidad que han servido en las Fuerzas Armadas en este país. En este centro se entregan muchos servicios, mucho cuidado de salud para los soldados que lo merecen y que ocupan nuestro apoyo. Pero también estamos aquí celebrando el progreso de California en cuestión de las vacunas. Más de 55 millones de vacunas se han repartido en el estado de California, más que cualquier otro estado en el país. Todo el mundo sabe qué tan importante son las vacunas. Las vacunas son claves para poder llegar al otro lado de esta pandemia. No solo los expertos médicos, no solo los científicos, sino los niños también. Y estamos celebrando que ya comenzamos a repartir vacunas para niños de 5 años en adelante, inclusive los míos. Mis dos chiquitos de edad 6 y 8 tienen su cita mañana y están tan entusiasmados por primera vez ir a recibir su vacuna, porque bien entienden qué tan importante es para proteger su salud, la salud de la familia, la salud de la comunidad y poder regresar a la normalidad en la escuela y con sus amigos. Así es que les pedimos a todos los adultos, si no se han vacunado, por favor no esperen. La vacuna es gratis, es efectiva y es necesario para por fin poner un fin a esta pandemia. Todos lo sabemos y pedimos a todos que hagan su parte, especialmente en esta temporada de reconocer los sacrificios de tantos veteranos que lucharon, sirvieron para proteger los demás. Es lo que cada uno de nosotros podemos hacer con esta vacuna, vacunarse para proteger a los demás. And with that, let me call forward the mayor of the great state of California and my dear friend, Gavin Newsom. Governor.
Sometimes I do feel like I'm the mayor of California, not governor. In many ways, it makes sense, right? If we talk about localism being determinative, a state vision is always realized at the local level. And so we're here at a remarkably important and potent local VA that is delivering for veterans, not throughout this region, but also throughout the state of California and all across the country. And so I'm honored to be here, Steve, with you and Mark and Vito. I'm here as well. Very, very proud to be with Senator Padilla and so many men and women that each and every day are not only putting shots in arms, but giving people shots of hope and opportunity and getting people back on their feet, giving people opportunities that otherwise wouldn't be afforded because of the extraordinary work that's being done in VAs all across this country. And so it's right to be here, day before Veterans Day. It's right to be here to celebrate progress and success of the great work that's being done down here to advance our cause of getting more people the immunity that they need and deserve, the immunity that we need and deserve as a community to get through this winter. I've been making this point for now a couple months. Winter is coming. Winter is here. And as we are wont to be reminded, should be reminded, last year we had a challenging winter, particularly down here in Southern California. We started to see around this time last year case rates, positivity rates, hospitalization rates, ICU numbers start to increase. You're starting to see that now all across the globe. We've seen those trends not dissimilar to last year in Europe, trends not dissimilar to last year in countries like Germany. Germany actually had record-breaking cases the other day. We are seeing those trends take shape in the Midwest and the Dakotas. We've seen them in Minnesota. You've seen them in Vermont and New Hampshire. Obviously, headlines have now been driven because of what's going on in Colorado. Less than 10% of their ICU beds now available. And so this, in so many ways, is part of the pattern that is familiar. And the one thing that can interrupt that pattern is the one thing we're here to promote, and that's increasing your immunity that does wane after a number of months, 6 or so months, by getting a booster shot, and reminding everybody of the opportunity to get their first shot if they haven't. We met a young man, not a time of life, but a quality of imagination, a youthful veteran, who said, "I'm here today to get my first shot." He said, "It took me a little convincing, but I'm here and I'm happy I'm here." He said, "I'm also here to get a little help with housing." And that put a smile to Senator Padilla's face and my face, reminding people that, as Dr. Galley said, the way out of this pandemic is to get people immunized. And so we want to continue to encourage that. At the same time, we want to acknowledge, as Senator Padilla did, the nation-leading vaccination efforts. 55.6 million doses of vaccines have been administered in the state of California. 89.7%, almost 90% of adults in California received at least one dose. Dr. Galley updated you on the efforts that were initiated and launched last Wednesday to get our children 5 to 11 vaccinated. Now north of 100,000 have been vaccinated, but we have roughly 3.5 million children that can afford themselves to that opportunity. 3,100 school sites now have been made available to support that cause. Hundreds of community-based organizations supporting that cause, work being done by not just pediatricians like Mark Galley, Secretary Galley, but pediatricians all across this state to address anxiety and concerns that many parents have around the dosing for their children and around the efficacy and safety of these vaccines. We recognize we have work to continue to do in that space. We're proud, though, nonetheless, by the partnership with the federal government, 1.2 million doses they're committing to for that cause, 5 to 11. Pharmacies will receive roughly 600,000 additional doses. So dosing is not the issue. Vaccines are in abundance. Vaccines are in abundance for boosters. Vaccines are in abundance for our kids. Vaccines, life-saving vaccines, are in abundance for anyone that hasn't yet gotten that first dose. So we want to remind people to avail themselves, remind people that we are starting to see increase in hospitalizations. You saw some headlines today in places like Riverside, San Bernardino. We're seeing case rates starting to rise. We enjoyed the summer, where we had the lowest case rates in America for a large portion of the summer. Just yesterday, we went up to about 16th lowest. That moved rather quickly. I say that not to alarm people, but to caution folks that it was around this time last year that folks started to put down their masks a little bit, started to feel like we can not, spend a little more time together outside of our households and understandably together for the holidays. And we're looking forward to all that. I'm looking forward to all of that and seeing friends and families. Just want to remind people to do it with some common sense and the kind of protections that we're here today to promote. And the most important and potent is getting that booster shot. I got my booster shot a few weeks ago, went off without a hitch. Got the Moderna shot, originally got the J&J shot, which I was proud to do. Didn't have a reaction to either shot. And I want to remind people that it's not only the vaccinations for COVID-19 to get this pandemic behind us, but also flu season. Last year, we didn't have much of a flu season. We're used to flu seasons and flu shots as being part of the prophylactics to address that. This year, just want to remind people that we want to avoid the twindemic that is referred to by some and get that flu shot. I got my flu shot about a week prior to getting that booster shot. Some people I was just talking to got the flu shot the same day that they got booster shot. And so I want to remind people to get those flu shots and get the booster shots. I'll also just, in closing, remind you, and I will highlight one other reason we're here at the end, but I want to remind you, you can go to My Turn. We have a webpage, My Turn, which will, has frequently asked questions, also has apps so you can schedule myturn.ca.gov, or just Google My Turn, Yahoo My Turn, Bing My Turn, and make some determinations around proximity and access to booster locations. And I just want to note that the overwhelming majority of people that are getting their boosters are getting them at pharmacies. In fact, just shy of 60% of people last week got their vaccines from pharmacies. We had about 726,000 booster doses in the last 7 days, last week in the state, a little shy of 1.1 million people getting shots, 131,000 yesterday. So we're starting to see those numbers go back up, over 1 million a week. But again, boosters being the majority at the moment, and again, pharmacies being the most convenient, seemingly most convenient way to get a boosters for many people. But local health officers, local health organizations, and your plans, I mean, across the spectrum, more locations, more choice. You have more voice in terms of those options and opportunities all throughout the state of California. So let's maintain that vigilance. Let's keep our eye on the ball. Let's recognize that there is a pattern, there is a seasonality to COVID-19. While we were spared the worst in this summer, the prospects of a challenging winter are upon us, and that's why we're doing everything in our power to prepare and to protect ourselves. And so that's a fundamental cause that unites us here today. But there's another cause, and I appreciate the reference a moment ago by Vito and others, that is important. It's a cause that really defines so much of the stress and anger, frustration people understandably have about not only their state, but our nation, but particularly here in our state. That's the state of the homeless issue. And many people over the course of the last few years have sat there bewildered at why there was a large encampment of tents of veterans, Americans' heroes, out there living on the sidewalk right here, right outside this facility. That's no longer the case. And I want to applaud Secretary of the VA. I want to thank the Biden administration. They quite literally picked up the call, not the baton. The baton was dropped in the last administration. They picked up the call and made this a priority. They worked with local agencies. They worked with nonprofits. They worked with LA County. They worked with local officials. They did the right thing. They gave dignity and respect to our veterans. They deserved, got them on the inside of these gates. Many of them gotten housing, permanent housing, many getting support, behavioral health support, physical health support, but many are still struggling. And that's why I'm very proud of the work VA here has done to meet people where they are, to bring those tents on the inside, to create a pathway out of those tents at a pace that meets people's needs, to cohort our veterans in a way where they feel protected and respected, and today to announce that because of a contribution from 5 Point and Lennar, Jeff, thank you for your leadership. Thank you for picking up the call and the mantle of responsibility. We're all in this together. Thank you to Lennar. They will be providing 86 tiny homes to our veterans on this site. Lennar didn't have to do that. They chose to do the right thing. They chose to be part of the solution. They could have pointed fingers. They could have talked about the way the world should be. Instead, they're doing something to help our seniors, give them dignity, not just a tent, but a key, a lock. It's a tiny home, but an opportunity to continue that transition. And I want to thank them for that, as well as the Hilton Foundation that provided money for wraparound services, supports to help the extraordinary staff here, and others provide mental health and other important supports to address the underlying reason so many people out in the streets and sidewalks in the first place. Listen, I've said this many times. I won't burden you with what we did in this recent budget, but 22 billion reasons. There's never been a number as big and bold and a strategy as comprehensive to address the issue of housing and homelessness in our state's history, I'd argue our nation's history, at a subnational level. $22 billion is being invested in the issue of affordability, housing, and homelessness to support these efforts all throughout the state of California. Yes, I see what you see. Yes, I'm mindful of what is happening, but I'm also more optimistic than I've ever been. You are seeing progress. I am seeing progress. We are witness to progress. There's a different intentionality, different support here, a different collaborative spirit with our federal government, with incredible work, Senator Padilla and his office aiding and guiding us with federal agencies, and of course, the support that has been persistent and consistent here at the local level, advancing this cause together. I'll close, and forgive me, extending with a long-winded point of personal privilege, as it were. Tomorrow I'll be celebrating, and Vito, you reminded me of this because I referenced it a little bit last year, Veterans Day, a little bit about my grandfather, who was a prisoner of war, Arthur Menzies. He spent years and years as a prisoner of war, marched in Corregidor, fought side by side in Philippines in World War II to defend our freedoms and our democracy. And his story, and I won't belabor it, is a story that can be told over and over again. While he didn't suffer the physical wounds of war, it was the invisible wounds of war that took his life. He took his own life after returning back from that experience overseas. And it's a reminder to all of us that it's often not what we see that is the real issue. It's what lies underneath. And let us be sensitive to those struggles, seen and unseen. And let us meet people where they are, and let us provide the kind of respect in substance that we do rhetorically when men and women are in uniform, when they come back and no longer wear that uniform, but often wear those wounds associated with their service. And so I'm very proud of this VA, Steve, your work, and the work of so many others that made possible that opportunity to make a small but demonstrable impact on the lives of many men and women that sacrificed so much for each and every one of us. So that's what brings us here today. We're grateful for the incredible leadership assembled, and we're happy to be here with all of you, and of course, happy to answer any questions.
Governor Newsom, good morning. Lena Bovian, KTLA 5 News. I'm going to ask you a question a lot of people are very curious about. It's a Daily Mail article that just came out citing someone very close to you that is alleging that you did in fact get an adverse reaction from the COVID-19 booster shot and the flu shot, that you were very sick, fatigued, experienced muscle weakness, and that's why you didn't go to the climate summit in Scotland, as opposed to what you said, having to go trick-or-treating with your kids.
And I'm sorry, the source for that again?
It's the Daily Mail.
The Daily Mail, and they have a source close to me.
A source very close to you.
Yeah, well, that's made up. I had absolutely no impact whatsoever from the COVID shot, nor the original, nor the booster. Absolutely none. No fatigue, even no soreness. I was actually commenting with Dr. Galley. In fact, Dr. Galley, I found someone to concur, one of the members of the staff here. I said, I actually had a little bit more of a reaction to my flu shot. And the doctor came up and said, we're actually having more people comment about the flu shot than they are the booster shot in terms of the soreness of the arm. So that's just made up. And I hope folks pause and reflect on these sources and consider the mishigash that's going on, not just in terms of some of these things related to booster shot, but the misinformation that's rampant around the intentional misrepresentation and misinformation around the efficacy and safety of these vaccines. These vaccines are life-saving. These vaccines helped us put a lid on COVID this summer. We're encouraging people to get their booster shots, and those that have not gotten immunity through a vaccine, we encourage you to consider that as we move into the winter.
So why didn't you go to the summit?
Oh, I made that crystal clear yesterday. I wanted to spend time with the family. I actually put out a statement saying just that, and had the privilege of doing something that I would have missed, and that was missing my kids' smiles and, you know, the challenge of putting them to bed after a long night trick-or-treating as they were hyped up on candy. We were going to miss, both my wife and I, that Halloween, that experience, and had an opportunity to think through that, how many more opportunities I'll have as a father of 4, oldest being 12, youngest at 5. And we were planning to go out there. And after, challenging and grueling few years on the campaign trail, feeling I'm on the treadmill, and having a family dinner where I woke up the next morning with a pit in my stomach, I think they were telling me something. Now as I needed to get off that treadmill, spend time with them, which I did that weekend, trick-or-treating. I went to anyone in Sacramento. It's a remarkable thing. I have 4 kids that all are in soccer, and they have what they call the Boo Fest tournament. So it's multiple soccer games, each kid. So I spent the weekend and and two of my kids got third place. See their smiles. I would have missed all that. And so I'm really pleased that I took their advice, decided to stay at home, and then spent my week in the office at the Capitol and got a lot of good work done.
Governor Cecilia Bogran from Univision. I'll ask you the question in English and I'll repeat it in Spanish just to have it on tape. If 46% of Latinos are still not vaccinated in California, what do you think we're missing? Or, because I know there's a lot of campaigns geared exactly for us, but is the message not getting across, or why do you think? 46% de los latinos aún no están vacunados en California. ¿Por qué cree que eso está pasando? ¿Será un error de las campañas? ¿Qué está fallando?
I'm really proud of California's stubbornness on this, our persistence. You're absolutely right to call out those disparities. Those disparities continue to persist. California, as you may know, was one of the first, if not the first state, to put an equity lens on our testing efforts as well as our vaccination efforts. We created a system that's been replicated in other jurisdictions with different nomenclature around quartiles to really target our efforts and to become more granular in terms of addressing where those gaps persist. What I mean by granularity is a recognition that you can't sell down through top-down advertising or social media, marketing and messaging campaigns, that we really needed to go into the community, knock on doors with trusted messengers, neighbors, with people that are respected in the community, quite literally speak the language, and do more to be more accountable to getting our message across and identifying concerns and issues. We made tremendous progress over the months in those vaccination efforts. Not similar, though, we're seeing similar challenges with the booster. Those similar gaps that persisted, that were closed with our initial vaccine efforts, they now exist with our booster efforts. And so we have partnerships with hundreds of community-based organizations. We, in fact, just signed off last week, Dr. Galley and I, on our marketing strategies for November and December to be much more nuanced, building on, interestingly, some of the success we had in outreach under the census program. And we are committed to the cause of reaching out to our diverse community. Forgive me for the long-winded response. At peril, I extend that response by asking Dr. Galley to fill in any blanks, but it's an important question, perhaps the most important question, because equity is our North Star, and those disparities are real, and those disparities have also been punctuated by the fact no other community in California has been more impacted by misinformation, disinformation, and the ravages of this pandemic than the Latino community. Doctor?
Governor, thanks for the comprehensive answer. I think the only thing I would add is I'll remind you early on, we saw a gap of about 24 percentage points between some of our most advantaged versus some of our least advantaged communities across the state. That includes communities of color, largely Latino communities. We have seen that gap shift from about 24% down to roughly 15%, so we are making progress. We have goals, aspirations, plans, ideas, work with our community partners, trusted messengers, voices in the faith community, the business community to deliver a message in language. As I like to say, it's time for us in healthcare to come to our knees, have those conversations face-to-face with those who have questions, and making sure our Latino communities across the state know where they can get trusted information, know where the answers can come from to make that decision. We see this all the time in healthcare. Early adopters of some therapies, of some medications, and then over time, many others come along. And we hope to see that more and more. We are seeing that. And our hope, our goal by the end of the year is to close that 24% gap down to single digits below 10%. And we're on track. There's a number of efforts targeting those who are in our Medi-Cal program, a third of Californians who receive their health care through Medi-Cal, targeted programs to work with those providers in that serve Medi-Cal patients across the state to make sure that we're getting in-language messages and all of the information out there. So absolutely true. We've seen the devastating impact of inequities in health care and other social areas, social service areas, but we are making progress in California, in no small part, Governor, to your great leadership and investment in these areas. And this work won't end. We will talk about the closing gap, but until it's entirely closed, we will keep at it, and we hope all of you will help us get that message across and join us in that work.
Mr. Governor, I'm going to add here, take a point of personal privilege. And I apologize if I called you mayor earlier. We've known each other a long time. We both started in local government. But in response to this question, there's 4 points I want to make rather quickly. Number one, at the beginning of the pandemic, when the vaccines were first rolling out, we did have issues, and there was a concern and question for many about access. And to your credit, utilizing federal and state resources, we made sure that vaccines weren't just available at big hospitals and some of the larger vaccination sites, but in pharmacies and through community clinics to better reach the communities that were impacted the most, especially the Latino community, number one. Number two, as more vaccines were being made available, we saw it then and we see it now. The struggle against misinformation and disinformation, and not just, but especially on social media. And so we're working to overcome those challenges with good information through trusted messengers. Number three, research has shown when their employers have either incentives or mandates to make available time off to get vaccinated, more workers get vaccinated. And so we need the partnership of the business community here too, and that has led to significant progress. And finally, let's not lose sight of the fact that the Latino community, look at the census numbers, is a younger community. And so when the vaccine was approved for 12-year-olds and older, and now 5-year-olds and older, we're going to move the needle more significantly with the Latino community more broadly, not just because the vaccines are available and available through schools, but because just as with recycling, just as with conserving water and energy, a lot of times kids are the ones that teach and motivate the parents. And so the gap has been closing, and I expect it to continue to close. En español, la pregunta fue que ¿por qué seguimos viendo tanta diferencia en el nivel de vacunación entre latinos y el resto de la población? Yo creo que al principio había preocupación sobre acceso a las vacunas, porque no todos vivimos cerca de un gran hospital. No todo el mundo tiene seguro médico, pero es la razón por cual trabajamos con el gobernador para hacer disponible la vacuna en farmacias en cada comunidad y en clínicas comunitarias en todas las áreas del estado. Seguimos combatiendo la mala información que existe no solo, pero especialmente en las redes sociales. Les pedimos de nuevo, por favor, confíen con la información y las recomendaciones de los expertos. La vacuna es segura y es efectiva, y la mejor manera de proteger nuestra salud y la salud de nuestra comunidad. Tercer punto, sabemos que cuando empleadores ofrecen el tiempo para trabajadores que vayan a vacunarse, más trabajadores se vacunan. Por eso hay incentivos y en algunos casos mandatos a los empleadores que ofrezcan ese tiempo para sus trabajadores que se vacunen para proteger sus colegas del trabajo, sus familias y nuestra comunidad. Y punto final, la comunidad latina es más joven que los demás. Y por eso vimos esa diferencia cerrándose cuando la vacuna se aprobó para niños de 12 años en adelante y ahora de niños de 5 años en adelante. Cuando los niños se vacunan, nuestra comunidad se protege mejor, y como en otras campañas públicas, a veces en nuestras familias son los niños que educan y motivan a los adultos. Hemos hecho mucho progreso y lo vamos a seguir haciendo. Gracias. Got that?
Hi, Governor. Alex Nieves with Politico. Will you be participating at all virtually in the Glasgow conference that ends Friday? Cal EPA has told us that is the case, but we don't see you on the schedule yet.
Yeah, I've done a number of videos, and I have a team out there, as you know, this last week. No state's done more on the issue of low carbon green growth to decarbonize and change the way we produce and consume energy. We're really proud of that. And they did a wonderful job led by the Lieutenant Governor out there in Glasgow, sharing those best practices around the rest of the world. So we will continue in that pace, regardless of this conference, to continue to lead the nation and the world in many respects with this pollution blanket that has led to extreme weather and extreme drought, not only here in California, but across the state, across states, large and small, all around the world. As it relates to upcoming events, those events will be made available, and make sure my team gets you more detail about those virtual events that we did participate in and those that we may participate in the next couple days.
Hi, Governor. Alex Michelson, Fox 11. Real quick question for Dr. Ghaly. From what you said, and then I have a question for the governor too, but Dr. Ghaly, from what you said, are you saying that everybody should get a booster if they want one? And is that in line with what the FDA is saying?
So the CDC was very clear that they had two categories, groups that should get a booster and groups that may. We know that a number of Californians work in crowded public settings with the public, and in that case, because of your work-related risk, or even you live with people who have underlying conditions, are at higher risk themselves, or you're a member of a community that's been ravished and hard hit by COVID. And in all of those cases, it's permissive by the CDC and the FDA to go ahead and get the booster. And we are saying, for all of the reasons we've talked about, increasing evidence that the longer you completed your series ago, that you might have waning immunity, that get yourself protected. And if you're interested, we're urging both people to go to their healthcare providers, go to their pharmacies, go to any site, and working with those sites to make sure that no one's turned away. So absolutely, if you are interested in getting a booster, we ask you to go ahead and get yourself signed up to get one.
Governor, this is the first time we've seen you since October 27th answering questions, and I know you missed us.
What day is it today? I'm just trying to get...
I know you missed us.
It's been a week.
I'm wondering, though, do you think that I think there's a lot of parents that could totally relate to what you said about spending time with your family for Halloween. Do you think that, or do you wish that you would have maybe said that first, more explicitly?
That I wanted to spend time with my family?
Yeah, I mean, because you said...
And Alex, forgive me for cutting you off. I put out a statement saying I want to spend time with my family, so we actually put that out.
Well, it said family obligations. Yeah.
Well, I don't know if it's an obligation to spend time with your kids, but my wife, who has been spending a great deal of time, disproportionate amount of time with the challenge of having a spouse, battling recalls, crisis to crisis. It was spending time with her and the kids, and we put out a statement accordingly.
Do you think that this has changed the way you think about the way that information gets out in this social media age? And sometimes when there's a lack of information, what happens? Has it changed the way you think about communicating at all?
I don't know. I was sort of bewildered. I drove into the office every single day, into the Capitol, walked the halls of the Capitol with my kids, spending time with my team quite literally every single day in my office. And I didn't see a lot of other folks. And then I start seeing some things bubble up on social media. Where's the governor? I'm like, wait a second. I'm at work. I'm doing work. I'm doing budgets. I'm doing work on port. We put out a number of statements about the work we were doing last week. So I don't know. I think what we're experiencing is remarkable mis- and disinformation campaigns that are going on across the spectrum in this country. I think this notion of vaccination misinformation is pretty well defined and documented, and it's alive and well in this case. It's just rather extraordinary. And so I think it's a good question. I think it's a question for all of us. It's a question in your industry. It's a question in mine and in whatever professional endeavor, how we push back against lies, misinformation, intentional and otherwise. And it's hard. It's a fire hose. And if you want to go down that rabbit hole of conspiracies, the like, it's a challenge. And that's nothing to do with the governor's office. It's much more profound than that all across this country. Obviously, we're seeing misinformation weaponized, notably from former President of the United States, the perpetuation of the big lie, and how a jaw-dropping number of Republicans believe it, and this notion of voter fraud, the very direct assault on the efficacy and safety of vaccines. It's alarming what's going on with that misinformation. So I think that's a very good question. It's a deeper question than the issue that you bring to the fore, and it's one we're all going to have to ponder and work against.
There was a protest 2 days ago in LA of LA County, LA City workers against the vaccine mandates that will take effect in December. And many of them said that they're willing to lose their jobs, very important jobs, if the government here in LA County, instead of getting the vaccine. What would you say to someone who says, I'm willing to lose my job instead of getting the vaccine? How do you convince them?
Well, everyone has the choice. I believe that local government has the right to make determinations, particularly on the basis of regional conditions and criteria, to move in the direction they feel is most appropriate to keep people healthy, keep people safe, and to mitigate community spread, particularly here in Southern California. I'll remind you this, last year, you recall, you had peak hospitalizations around the first week of January. We were bringing in mobile morgues. We had a difficult time identifying body bags. Thousands of people lost their lives, thousands of people on life support who close to death. And I think local leaders are mindful of that and want to keep people protected and safe next year. And so they're moving forward as the President of the United States on either getting vaccinated and or getting testing. California hasn't been shy in that space. And people have the right to choose not to do that. And there's consequences to that. And I just encourage folks to consider that we're all in this together. That when it comes to the issues of virology, epidemiology, when it comes to issues of pandemics, health, that I am because you are. This notion that there's no leak on your side of our boat. And I think it's really important in terms of the question you posed that I would offer some consideration beyond just the self. That the impact of individual decisions are felt by others, and God forbid by someone you love. God forbid you bring that home. God forbid you bring it to a stranger that you meet who has an immune system that's compromised or a medical condition. And I don't think anyone wants to see that happen. So I encourage people to consider the science, the data, the facts, the safety and efficacy of these efforts, and continue to support local decisions in terms of what communities like LA feel are best to protect populations, particularly as large, as abundant, and diverse as those that we celebrate here in LA County. So thank you all. We will be celebrating tomorrow, Veterans Day, and I hope we all reflect, take time, and pause on our responsibility to do more and do better, to serve those that protected and served us. Thank you all very much.